European settlers arrived with smallpox, and they left with something they never expected: a medical system thousands of years older than anything they had brought. Number 18 contains a compound pharmaceutical that researchers spent 11 years trying to synthesize and then gave up. Number 6 treated the respiratory infections that were killing European soldiers while the people who knew it survived. These are 25 Native American healing remedies the rest of the world is only now beginning to understand. Number 25. Osha root. The Rocky Mountain tribes called it bear medicine because they observed grizzlies digging the root after emerging from hibernation, chewing it to clear the mucus and respiratory congestion that accumulated through months of shallow winter breathing. Ute and Cheyenne healers used it for every chest complaint that came to them: bronchitis, pneumonia, altitude sickness, the deep lung infections that were the leading cause of death in high-elevation communities before antibiotics. The root was dried, chewed raw, or steeped into a strong, bitter tea. The smell was intense, sharp, almost medicinal in the way only roots that contain real chemistry smell. A pound of dried Osha root cost nothing because it grew across every mountain meadow and wooded slope above 7,000 feet. Modern phytochemical analysis has identified Z-ligustolide in Osha root, a compound with confirmed bronchodilatory and anti-inflammatory properties in respiratory tissue. A 2012 study in the Journal of Ethnopharmacology documented Osha's traditional use and confirmed significant antimicrobial activity against the respiratory pathogens most associated with pneumonia. Number 24. Usnea lichen. This is the remedy most Americans walk past without recognizing. The long gray-green strands that hang from tree branches in old forests from the Pacific Northwest to the southern Appalachians look like Spanish moss, but they are not a plant. They are a lichen, a composite organism of fungi and algae living in permanent partnership. Every native people who lived in forested regions of North America used Usnea medicinally, for wounds that were infected and slow to close, for respiratory infections that would not resolve, for urinary tract complaints. The preparation was simple. The dried lichen was steeped in hot water or infused into oil. Usnic acid, the primary active compound, has documented broad-spectrum antibacterial activity against gram-positive bacteria, including Staphylococcus aureus and Streptococcus. A study published in 2002 in the International Journal of Antimicrobial Agents confirmed Usnic acid's significant antimicrobial activity. European pharmaceutical companies have studied Usnic acid for decades. The healers of a dozen American nations had been applying it to infected wounds for centuries before the first laboratory was built. Number 23. Burdock root. The large-leafed plant with the sticky seed pods that attach to clothing and dog fur was not a nuisance to Native American healers. It was a pharmacy. Cherokee, Mohawk, and Iroquois peoples used burdock root for skin conditions, liver complaints, and the joint inflammation that came with age and hard use. The root was dug in autumn, boiled into a tea, or eaten cooked like a vegetable. Japanese medicine, independently, arrived at almost identical applications, and burdock root, called gobo, remains a staple food and medicine in Japan today. The root contains inulin, a prebiotic fiber that feeds beneficial gut bacteria, and arctogenin, a compound with confirmed anti-inflammatory and anti-tumor properties. A 2011 review in the Journal of Ethnopharmacology documented burdock's traditional uses across multiple indigenous cultures and confirmed its anti-inflammatory activity. The plant that most suburban homeowners spray with herbicide was considered a medicine of first importance by healers who understood it. Number 22. Milk thistle. Thistle of various species grew across the grasslands and disturbed soils of the American continent. Native peoples who encountered milk thistle either native varieties or the European species that arrived with colonists, rapidly incorporated it into liver medicine. Lakota and other plains peoples used thistle preparations specifically for what they recognized as liver complaints, the jaundice, the fatigue, the swollen abdomen that came with liver disease. Silymarin, the active compound complex in milk thistle seed, is now one of the most extensively studied plant compounds in hepatology. A 2005 review published in the American Journal of Gastroenterology documented silymarin's liver protective effects across multiple clinical trials, including its ability to reduce liver enzyme levels in patients with hepatitis, cirrhosis, and drug-induced liver injury. The FDA has approved milk thistle as a dietary supplement for liver conditions. The liver medicine of the plains was confirmed by the gastroenterology journals a century later. Number 21. Red root. Ceanothus americanus, called red root for the vivid crimson color of its inner bark, was one of the most important lymphatic medicines in the Eastern Woodlands tradition. Cherokee, Iroquois, and Delaware healers used it specifically for swollen lymph nodes, enlarged spleen, and the infections that settled into the lymphatic system and refused to clear. During the Civil War, Confederate soldiers used red root tea as a substitute for black tea when supply lines were cut. The astringent tannins in the leaves made an acceptable beverage. But the root was the medicine, given specifically for what healers described as sluggish lymph, which we would now recognize as lymphadenopathy from chronic infection. Modern herbalists consider red root one of the most effective lymphatic agents in North American botanical medicine. Research on ceanothin and related alkaloids in the root has documented significant anti-inflammatory and coagulant properties, explaining the traditional use for swollen lymphatic tissue. Number 20. Lomatium root. During the 1918 influenza pandemic, a curious pattern emerged in Nevada. The Washoe people, who had been using lomatium root medicinally for generations, appeared to have significantly lower mortality from the pandemic flu than surrounding populations. A physician named Ernst Krebs documented this observation and spent years investigating it. Lomatium dissectum, a large carrot family plant with a massive aromatic root, was the Washoe treatment for respiratory infection, and they gave it as a tea at the first sign of any lung illness. Modern research has identified tetronic acids and a unique galactomannan fraction in lomatium root, with confirmed antiviral activity against influenza and other respiratory viruses. A study in 2009 documented lomatium's antiviral properties. The Washoe people had no way to run a randomized controlled trial in 1918. They had generations of observation and a root that apparently worked. The pandemic data suggested they were right. When European colonists arrived in North America, they classified indigenous medicine as superstition and witchcraft as a matter of official policy. The same healers those colonists dismissed were managing diseases on a continent the size of Europe with nothing but the plants growing around them. The clinical literature of the last 50 years has been examining those plant medicines one at a time and finding, with remarkable consistency, that a significant percentage of them contain the pharmacological activity the healers said they contained. The dismissal was not based on evidence. It was based on power. 19 more. Number 19. Grindelia. The bright yellow wildflower that grows across the dry grasslands of the American West was the standard respiratory remedy of the California tribes and the Great Basin peoples. Pomo, Miwok, and Paiute healers applied the sticky, resinous flower heads as a poultice for poison oak rash, and brewed the dried aerial parts into a tea for asthma, bronchitis, and the dry, racking cough that came with respiratory infections in the desert communities. Spanish missionaries who contacted these peoples in the 1770s noted the use of Grindelia for lung complaints. A century later, it appeared in the eclectic medical texts as an approved treatment for bronchial asthma, and was listed in the United States Pharmacopoeia from 1882 to 1926. Grindelia contains grindylic acid and diterpene resins with confirmed expectorant and bronchodilatory properties. A review published in the Journal of Ethnopharmacology confirmed Grindelia's traditional respiratory applications and documented its pharmacological activity. The California tribes who brewed this tea for asthma were treating the correct condition with a pharmacologically appropriate plant. Number 18. Yerba Santa. The large, sticky-leafed shrub that covers the dry hillsides of California and the Southwest is sacred to the Chumash, Yokuts, and many other California peoples. The Spanish called it the holy herb, Yerba Santa, because they observed how widely and confidently indigenous healers used it. The leaves were dried and smoked, burned as incense, or brewed into tea for asthma, bronchitis, and respiratory infections. The compound ariotictiol in Yerba Santa has been studied as a flavor modulator, and it is the active ingredient in Procter & Gamble's patented bitter-blocking compound used to make unpleasant medications more palatable. A pharmaceutical company studied this plant long enough to patent one of its compounds. The California peoples who called it the holy herb and treated their lung patients with it were not practicing primitive medicine. They were practitioners who knew their pharmacopoeia as precisely as any physician. Number 17. Elecampane. The tall, stately plant with large, velvety leaves and bright, daisy-like yellow flowers is not native to North America. It arrived with European settlers who brought it from the Old World specifically because they needed it. But it was rapidly adopted by Eastern woodland peoples who recognized its properties through contact with settlers. And by the mid-1800s, it had become embedded in both settler and indigenous medicine in the eastern United States. Elecampane root contains inulin, the same prebiotic fiber in burdock, and allentolactone, a sesquiterpene lactone with confirmed antibacterial and antiparasitic activity. Healers on both sides of the cultural divide used it for chronic respiratory conditions, intestinal parasites, and what they described as weakness of the lungs. A 2007 study in phytotherapy research documented allentolactone's confirmed antimicrobial activity against Mycobacterium tuberculosis, the bacterium responsible for tuberculosis, which was the leading infectious killer in 19th century America. The plant used for lung weakness was active against the primary lung pathogen of the era. Number 16. California poppy. This is not opium. This is a completely separate species, Eschscholzia californica, with no opioid alkaloids and no risk of dependency. The Chumash, Cahuilla, and many other California peoples used the whole plant, including the root, as a gentle sedative and pain reliever for toothache, headache, and the anxiety and sleeplessness that came with illness and loss. Children were given mild preparations. The elderly used it for the chronic pain of arthritis and the sleeplessness of advanced age. After gold rush settlers flooded California in 1849, this knowledge spread rapidly into settler communities who had no other sedatives available. California poppy contains californidine and other alkaloids that bind to GABA receptors and serotonin receptors, producing mild sedation without the dependency risk of opioid preparations. A 2004 study published in Phytomedicine confirmed significant anxiolytic and sleep-promoting properties. The healers who gave it to sleepless children were delivering a pharmacologically appropriate, dependency-free sedative. Number 15. Cramp bark. The highbush cranberry, Viburnum opulus, was the women's medicine of multiple eastern woodland traditions. Ojibwe, Potawatomi, and Menominee healers used the bark specifically and consistently for menstrual cramping, threatened miscarriage, and the muscle spasms that complicated childbirth. The bark was simmered into a tea and given in the first hours of severe menstrual pain. Women who knew it trusted it the way a later generation would trust ibuprofen, as the reliable first response to a predictable and manageable pain. Cramp bark contains vioputyl and scopolamine, antispasmodic compounds that directly relax smooth muscle tissue. A 2014 review in the Journal of Ethnopharmacology documented cramp bark's traditional obstetric and gynecological uses across multiple indigenous North American cultures, and confirmed the pharmacological basis for its antispasmodic activity. The women's medicine of the Ojibwe was based on confirmed pharmacology that formal research took until 2014 to publish. Number 14. Sarsaparilla. The climbing vine with broad leaves and red berries was known across the Gulf Coast and Caribbean regions as a blood purifier and skin medicine. Cherokee, Creek, and Choctaw healers used sarsaparilla root for psoriasis, eczema, the joint inflammation of rheumatoid arthritis, and the broad category of conditions they attributed to blood that needed cleaning. By the 1820s, sarsaparilla had become one of the most commercially valuable medicinal exports from North America to European pharmaceutical markets. European physicians used it for syphilis. American eclectic physicians prescribed it for skin conditions and joint disease. It remained in the United States pharmacopoeia through multiple editions. The plant contains steroidal saponins, compounds that reduce systemic inflammation through mechanisms that modern immunology is only recently beginning to fully characterize. The root beer that carries its name today contains none of the actual plant. Number 13. Lobelia. This small-flowered annual plant was one of the most powerful and controversial medicines in early American botanical practice. Cherokee healers used it for asthma, placing dried leaves directly in a pipe and smoking the vapor to open bronchial passages during acute attacks. Samuel Thompson, an early American herbalist who learned from indigenous healers in the late 1700s, built an entire medical system around lobelia. He was tried for murder when a patient died after treatment, and he was acquitted because the death was attributable to the underlying illness, not the plant. Lobeline, the primary active compound, acts on nicotinic acetylcholine receptors in the lungs and brainstem. It has bronchodilatory effects and was the active ingredient in commercial stop-smoking preparations sold in American pharmacies through the 1990s. The Cherokee asthma remedy was later synthesized, patented, and sold as a pharmaceutical smoking cessation aid. Here is the number that frames everything else on this list. When European explorers and colonists first made sustained contact with North American indigenous peoples in the 1500s and the 1600s, they documented, almost universally, that the populations they encountered were in significantly better physical health than the European populations they came from. Taller, stronger teeth, lower rates of chronic disease, better vision. The diseases that killed indigenous peoples in catastrophic numbers after contact were the diseases Europeans brought, including measles, smallpox, typhus, and cholera, against which indigenous peoples had no prior immune exposure. The indigenous medical systems were not inadequate to indigenous health conditions. They were highly adapted to them. The question worth asking is not why indigenous medicine failed. It is why it was so systematically erased. Number 12. Sweetgrass medicine. Sweetgrass, Hierocloe odorata, is known primarily as a ceremonial plant. Its braided form was carried in medicine bundles and burned as incense across the Plains and Great Lakes traditions. But its medicinal uses were equally real. Cree and Blackfoot healers used sweetgrass preparations for chapped and infected skin, for the respiratory complaints that came with cold weather, and as a postpartum wash to prevent infection after childbirth. The plant contains coumarin, the compound responsible for its distinctive vanilla-like scent. Coumarin has confirmed antimicrobial properties and was the basis for warfarin, a blood-thinning pharmaceutical that originated after spoiled sweetgrass hay caused bleeding in cattle. That chain of events, which no one intended, led directly to a pharmaceutical that is now on the World Health Organization list of essential medicines. Number 11. prickly ash bark. The small thorny tree, called the toothache tree for the numbing sensation of chewing its bark, grows across the eastern and central United States. Cherokee, Chippewa, and Potawatomi healers used prickly ash bark for toothache, joint pain, and the circulatory complaints that came with cold climates. They treated hands and feet that never warmed and veins that ached in winter. The tree's bark contains xanthoxylin and related alkaloids with confirmed local anesthetic and circulatory stimulant properties. The numbing effect on dental pain is immediate and unmistakable. Modern herbalists consider prickly ash one of the most effective circulatory stimulants in North American botanical medicine. A review in the Journal of Ethnopharmacology documented prickly ash's traditional cardiovascular and pain applications and confirmed the pharmacological activity of its alkaloids. Every person who ever broke a twig and held it against an aching tooth was self-administering a legitimate local anesthetic. Number 10. Marshmallow root. The marshmallow plant, Althea officinalis, arrived in North America with European colonists who brought it from the Old World as a medicine. It was rapidly adopted by Eastern woodland peoples who recognized its properties and incorporated it into their practice. The root, when simmered in water, produces a thick mucilaginous liquid indistinguishable in texture and function from slippery elm, and the two plants were often used interchangeably in communities where both were available. It was used for sore throats, stomach inflammation, urinary tract irritation, and the dry, irritated respiratory passages of winter illness. The Food and Drug Administration has approved marshmallow root as a Category 1 safe and effective demulcent. Marshmallow confections were originally made from the root's mucilage mixed with sugar, the sweet that kept children from spitting out their medicine. The modern marshmallow contains none of the plant. Number 9. Black haw bark. The viburnum family gave indigenous North American medicine two of its most important antispasmodic plants, cramp bark and its close relative black haw. Viburnum prunifolium was used consistently across the Midwest and South by Osage, Choctaw, and Cherokee healers for the same applications as cramp bark, menstrual cramping, threatened miscarriage, and uterine spasm, but with the additional documented use for high blood pressure. The bark contains scopolamine, a coumarin derivative with both smooth muscle relaxant and mild antihypertensive properties. Civil War physicians who observed its use among Southern populations incorporated it into eclectic medical practice, and it was listed in the United States Pharmacopoeia from 1882 to 1950. A tree that grew in the thickets along every creek bottom in the American South was antispasmodic and antihypertensive medicine that formal American medicine eventually recognized and then forgot. Number 8. Motherwort. The European colonists who brought motherwort, Leonurus cardiaca, to North America called it the heart herb, and the indigenous peoples who adopted it applied it immediately to the cardiac conditions for which it was known in the Old World. Iroquois and Ojibwe healers used motherwort for heart palpitations, anxiety, and what they recognized as the racing, irregular heartbeat that came with severe stress and grief. The connection between emotional distress and heart irregularity, what we now understand as stress-induced cardiac arrhythmia, was clearly recognized in both European and indigenous medical traditions long before cardiology gave it a name. Leonorine, the primary active compound in motherwort, has confirmed negative chronotropic effects. It slows the heart rate through a mechanism involving calcium channel modulation. A 2011 review in Phytochemistry documented leonorine's cardiac effects and confirmed the traditional use for palpitations and mild arrhythmia. The heart herb was correctly named. Number 7. Licorice root. Native varieties of licorice, Glycyrrhiza lepidota, grew across the prairie regions of North America, and the Plains peoples used them in ways strikingly parallel to the medicinal uses of cultivated licorice in Asian and European medicine, which they developed completely independently. Lakota and Blackfoot healers used prairie licorice root for sore throats, stomach complaints, and as a treatment for fever. The root was chewed raw, boiled into a tea, or given to children as a palatable base for other less pleasant medicines. Glycyrrhizin, the primary active compound, is anti-inflammatory, antiviral, and expectorant. It is used pharmaceutically in treatments for hepatitis C, as an expectorant in cough preparations, and in topical treatments for eczema. Licorice root is listed in the official pharmacopoeia of over 30 countries. The Plains healers who chewed this root for sore throats were using a plant whose active compounds appear in the official medicine of 36 nations. Number 6. Cedar bark and leaf medicine. Red cedar, Juniperus virginiana in the east, Thuja plicata in the Pacific Northwest, was sacred medicine across more North American cultures than almost any other plant. The applications were specific and consistent across peoples separated by thousands of miles who could not have communicated. For respiratory infections, people used cedar leaf tea or steam inhalation of cedar boiled in water. For fungal skin infections, cedar oil was applied directly. For arthritis, cedar baths and poultices were used. For fever, cedar tea was used to induce sweating. During the 1918 influenza pandemic, when public health officials in several regions recommended cedar steam inhalation, they were drawing on knowledge that indigenous healers had applied for centuries. Thujone, the primary volatile compound in cedar, has confirmed antimicrobial and antifungal properties. Cedar oil is now used in pharmaceutical preparations for respiratory conditions and topical antifungal applications. The sacred medicine was also precise medicine. Number 5. Astragalus. The milk vetch, Astragalus species, grows across the grasslands of the American West, and multiple plains peoples use the root as what they described as a strengthening medicine, given to the sick recovering from illness, to the elderly declining in vitality, and to warriors before campaigns. The Chinese tradition of Astragalus membranaceus, Huang tea, is more widely known, but the American species was used in strikingly parallel ways by peoples who had no contact with Chinese medicine. Modern immunology has identified astragalids, complex polysaccharides in the root, that activate natural killer cells, stimulate interferon production, and measurably improve immune function. A 2004 review in the Journal of Clinical Oncology documented astragalus supplementation improving survival and immune parameters in cancer patients receiving chemotherapy. The strengthening medicine of the Plains peoples was an immunomodulator that oncology eventually confirmed. Number 4. Devil's Club. The enormous armed plant of the Pacific Northwest rainforest, Oplopanax horridus, was one of the most sacred and powerful medicines of the coastal peoples. Haida, Tlingit, and Salish healers used Devil's Club root bark for type 2 diabetes before type 2 diabetes had a name. For the excessive thirst, the fatigue, the slow healing wounds that they recognized as a distinct condition. The plant was also used for respiratory infections, arthritis, and as a general restorative. Researchers investigating the reported anti-diabetic effects found that Devil's Club contains polyacetylenes and triterpenoids that inhibit alpha-glucosidase, the enzyme that breaks down carbohydrates into glucose, raising blood sugar. The same mechanism is targeted by acarbose, a pharmaceutical prescribed for type 2 diabetes. A 2011 study in the Journal of Ethnopharmacology confirmed significant alpha-glucosidase inhibitory activity. The coastal healers who treated sugar sickness with Devil's Club root were hitting the correct molecular target. Number 3. Chaparral, the most controversial plant on this list. Laurea tridentata, the creosote bush, is the dominant plant of the Sonoran and Mojave deserts. Tohono O'odham, Seri, and Navajo healers used it for almost every condition that came to them, including arthritis, respiratory infection, kidney complaints, skin disease, and what they described as growths. It smells strongly of rain on desert soil because it produces Nordehydraguairetic acid, NDGA, one of the most potent natural antioxidants ever identified. In the 1960s, the National Cancer Institute studied NDGA for potential anti-cancer applications and found significant activity against cancer cell lines in laboratory studies. Case reports emerged of patients self-treating cancer with chaparral tea and experiencing tumor regression. The FDA issued a warning against internal use in 1992, citing liver toxicity concerns from case reports that involved extremely high doses. The debate in the pharmacological literature about chaparral's actual risk-benefit profile at traditional doses has never been fully resolved. The desert healers who used it understood dosage as precisely as any pharmacist. The regulatory action addressed the extreme, not the traditional. Number 2. Spilanthes, toothache plant. Acmella oleracea, called the toothache plant in virtually every culture that knew it, produces a local anesthetic effect so immediate and unmistakable that its medical use required no translation across cultural boundaries. Chew the flower head, and the entire mouth goes numb within 60 seconds. Cherokees and other eastern woodland peoples used it for toothache, mouth infections, and sore throats. Pharmaceutical researchers have studied spilanthol extensively for potential clinical applications. A 2013 review in Molecules documented spilanthol's confirmed anesthetic, anti-inflammatory, and immunostimulant properties. You can grow the toothache plant from seed in a window box for $3. It produces the same active mechanism as the injectable anesthetic your dentist uses at $40 a cartridge. Number 1. Pau d'Arco bark. The final remedy on this list comes from the indigenous peoples of South America rather than North America, but it belongs here because it represents the most important unresolved question in ethnobotanical medicine. Tabebuia impetigonosa, called Pau d'Arco or lapacho, was used by Inca healers and by multiple Amazon basin peoples for infections, for what they described as growths, and for conditions we would now classify as fungal disease. The bark tea was used for candida infections, for the systemic fungal conditions that plagued populations in humid tropical environments, and for the tumors that appeared in aging populations. Lapachol and beta-lapachone, the primary active compounds, have been the subject of extensive research. The National Cancer Institute studied lapachol for cancer treatment in the 1970s and found significant anti-tumor activity, but dose-limiting toxicity at the concentrations required for cancer treatment. At the lower concentrations used in traditional preparations, beta-lapachone has confirmed antifungal activity that explains the traditional use for fungal conditions. A 2009 review in Phytomedicine documented Pau d'Arco's antifungal and anti-inflammatory activity. The Inca healers were correct about the antifungal applications at traditional doses. The anti-tumor activity at pharmaceutical doses remains an active area of research. 25 medicines, from a medical tradition that covered a continent. Developed over thousands of years by practitioners who tracked outcomes across generations and refined their pharmacopoeia through observation that no clinical trial can fully replicate. The plants on this list did not stop working when they were dismissed. Some of them are now in pharmaceutical products. Some are in active clinical research. Some are still waiting for the laboratory to catch up. Walk outside this week. Look at what is growing in your region. The plants your great-great-grandmother would have recognized as medicine are likely within walking distance. The knowledge of what they are for is one generation from silence. Subscribe to Forgotten American Ways. We are going to keep bringing it back.